Today we're going to have a look at using a stretchy wrap baby carrier with a baby who is using a Pavlik harness for hip dysplasia. If you have a baby in any type of orthopedic aid, it's especially important to check with a healthcare professional before using any type of baby carrier. But the method I'm going to show you is a way to avoid interfering with the work of the harness and making sure that your baby is safe and secure. So when you use your stretchy wrap, you can tie it on according to the manufacturer's instructions, and it will look something like the one that I've got on here. So you'll have a big X on your chest and a horizontal section and then a knot at the base. When we place a baby in from the top, we start to dictate their hip position for them. In the case of a baby using a harness, we want to make sure that the harness is doing that work. So what we're going to do is slide our hands underneath these pieces on the shoulder, underneath the two sides of the X, and I'm going to bring them down in two large loops and sit them quite low down here so they're easy to identify, and they're going to look a little bit like braces coming up and putting your arms inside. What that enables us to do is to pick up our little one and position them against our chest. In the position there, the harness will hold them in. So they have freedom to move their arms around, so we'd like to give them that freedom, and if they're not sure where their arms should go, pop them up next to the face. They have freedom to move their head from side to side, but you should encourage them to gently just look off to one side to make sure that they're visible and kissable all of the time. When we put a baby where we want them to be and then use the carrier to keep them there, it's often easier to settle them against your chest first, so don't feel worried if you spend several minutes like this before bringing the carrier up, settling them down. That's perfectly okay to do. So when we're going to dive our arms inside these pieces down here that work like braces, I'm going to hold the baby gently against the chest and bring the carrier up and over the knee, diving the arm inside and placing it up against the shoulder. We can swap hands on the baby and we can do exactly the same on the other side. You can see why I put the carrier nice and low down, which helps you to identify the right piece, bringing it up at the back of the knee and sliding your hand up and into the carrier itself. So once you've got your baby against your chest, you can start to see that we're not interfering with the movement and the position of the legs, the hips, or how the harness is working. When you start to pass the cloth across the baby's back, there's always a piece that's closest to the baby and a piece that's furthest away. You can usually feel which one underneath here just by rubbing your finger across those two pieces of cloth. Once you've identified the one that's closest to the baby, you can find the edge and bring it across the baby's back, from the back of the knee to the back of the knee, using the whole width of the cloth as you come across. Then we can do exactly the same thing on the other side, finding the inside edge of the cloth and bringing it up and over your baby's back, spreading it out from the back of the knee to the back of the knee and not interfering with how their legs would naturally sit in the harness shape. If you want to, you can flip the shoulder down, which allows you to gently encourage the baby under the opposite side and allow them to have a little extra support for the head. There is one last piece to put up, and again it's coming up and over the legs, so it's important that we give our baby in the harness enough space. We're always looking for the bit that's highest up underneath your arm. If you run your thumb down, you'll find a piece of cloth. That very first piece of cloth, you pop your thumb all the way through so your palm pokes out the bottom, and we push the cloth down towards the ground. This is where the stretch of the cloth comes into play, because as you push it down to the ground, you're able to bring it out and over the leg and sit it exactly where it was naturally. Same thing on the other side. Find that very top edge, stick your thumb all the way through it and bring it down and up over the knee to sit gently at the back of the joint, and then bring the carrier up and over to finish the job. So when we're using a stretchy wrap for a baby in a Pavlik, it is all about making sure that we don't interfere with the work of the harness. If you're ever concerned, you can open the carrier at each side. You can feel the tension in the downward pieces that come from the chest and attach to the back of the knee, bringing the cloth down all the way underneath baby's bottom. Now, the traditional way to take a baby out of the stretchy wrap is to lift them up into the air, but because of the Pavlik, we don't want to pull down on the legs or increase or put any pressure on the hip joint. So we're going to do the opposite of what we did to get the baby out again. And push the cloth all the way down to underneath baby's bottom, and hooking your thumb over the cloth, bring it down and out over the foot, and the same thing happens on the other side. As I bring those outside edges down, I can slide my arm up and out and bring it over the foot so it sits down at the side like braces, and I'll do exactly the same thing on the other side, bringing the cloth off the baby, down and over the shoulder, hand comes through and the whole carrier is off, and the baby is in the position that you left them in, with the harness doing the work of keeping them in a hip healthy position, the one that's right for them.